Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Hirsutism. Most common cause of hirsutism is polycystic ovarian disease. Most common cause of rapid onset hirsutism is androgen secreting ovarian tumor. If a female has history of hirsutism, then there can be two things. One, clinically we do Ferryman-Galloway score is done. If this Ferryman-Galloway score is found to be more than or equal to 8, then it indicates hirsutism. Second, biochemically, we will see serum testosterone levels. Biochemically, if serum testosterone levels are normal, then it is idiopathic hirsutism. Biochemically, if serum testosterone levels are increased but they are less than 200, then it may be polycystic ovarian syndrome or late onset congenital adrenal hyperplasia. Biochemically, if serum testosterone levels are more than 200, then it indicates androgen secreting tumor of ovary. So serum testosterone levels, we have three levels. One, if it is normal, then it is idiopathic hirsutism. Second, if it is less than 200, then it is polycystic ovarian disease at late onset congenital adrenal hyperplasia. If it is more than 200, then it is due to an androgen secreting tumor of ovary.
thank you and thank you for watching.